considerations for return to competitive sports, our theme for this evening. All guidelines and protocols, be they medical or social or governmental policy decisions, are fundamentally related to the protection of the community, and in other words, to protect the community from the spread of the SARS-CoV-2 virus by our actions meaning sporting actions, return to sport, and of course, protection of self. That goes without saying. The transmission risk and prevention of community spread of COVID-19 requires a reclassification of the risk of the individual sports based on almost daily emerging information. This information is gained almost exclusively, sometimes only, from the continuous testing for COVID-19. No testing, no information. Therefore, as the topic suggests, I'm going to focus on testing and how it relates to return to competition. Testing. By this, I mean testing for the detection of the SARS-CoV-2 positive person. The problem with testing is, much like vaccination, is that it isn't effective unless you get a high proportion of people tested regularly. I'll say that again. Problem with testing is that it isn't effective unless you get a high proportion of people tested regularly. And that's in the general population. For sports, it's almost unless you get everyone tested all the time. So for return to sport, this goes even further. Should we test everyone? And if so, how often? So just a bit of a background for context. Testing is safe. Testing is safe. Two types of tests for the virus that cause COVID-19 illness. The viral tests, like the rapid tests and the PCR tests. Of these, they test for current infection. The antibody test, another type, and this test for previously infected persons, but I want to elaborate here because those are expensive and time-consuming and need specialized input. The CDC guidelines of 2 days ago, the 19th of February, indicates that not everyone in the general population needs to be tested. Only people who have symptoms and people who have had close contact, less than 6 feet, cumulative total of more than 15 minutes over a 24-hour period with someone who has been positive. But that's for the general population. Guidelines for sports persons will obviously, and people competing closely will obviously differ. The types of viral tests, as I said, are like the rapid test. That's an antigen test where it detects a piece of the coating of the virus. And this is highly specific. If it says it's positive, that means almost certainly, not almost certainly, definitely COVID-19. But it's less sensitive. It misses a lot of people, especially in the early stages. Let me qualify that. About 30% of false negatives sometimes. Rapid tests are used for large-scale screening, and generally they are much cheaper and give a lot quicker results. The other test, which we would hear about, detects the RNA, which is a part of the virus's genetic makeup. And this is the PCR test. It's highly sensitive, so it's hardly going to miss anyone, but it can unfortunately remain positive for some time, and in people who are no longer sick or shedding the virus. So it gives a bit of a problem. So if it's still positive, is this person, can this person return or not? These PCR tests are really the gold standard for return to play. And turnaround time is longer, and the cost it's more expensive. But you would have heard Mr. Holder speak about having PCR tests on quite a regular basis. So can you test negative and later test positive for the COVID-19 with this viral test? Well, yes, it's possible. In certain circumstances, you may test negative if the sample was collected too early, and this is with the rapid test, and you can then test later on in your illness. or you can be exposed to COVID-19 after you've had the first test. So returning to competitive sport requires a robust COVID-19 testing plan, and is a major component of any necessary protocol for going back to sport. Such guidelines would, for sport and training, competitive sport especially, but training included, guidelines for return to competitive sports will incorporate certain health and safety protocols, and they must include the type and the level of sport that you're playing. In other words, whether indoor versus outdoor, contact versus non-contact, vocal versus non-vocal. Those vocal versus non-vocal are terms that I'm using because some sports, everyone shouts very loud. Some sports, no one says anything. Clearly, the ones who shout will require a much greater distance for safety. This will reflect the type, timing, and the frequency. The type of sport and the level of sport reflects the type, timing, and frequency of the test. All sports at all levels should be, and most are instituting mandatory testing programs, those who have returned to sports. And this is a reality in almost all professional sports, as we've heard from Mr. Holder, certainly in cricket, primarily in professional sports where financial considerations are important, broadcast rights, certainly in India, betting. Will high transmission risk sports require a more rigorous testing regime? Clearly, more often, less often, and also updated testing for cardiac and exercise considerations are important in those who are returning with the COVID-19, post-COVID-19 infection. Also, consideration should take into account but when to shut it down. If we return, certainly there must be some consideration of when we're going to shut it down. Continuous testing should be based on local evidence, not only overseas evidence. So every sport must implement its own policy. All sports, all players should have a negative PCR test. This should be the gold standard. At least a negative rapid test. Those who are positive should not go back, who have been positive should not go back until at least 14 days past the last positive test. Those who have been positive should be seen by a doctor before they go back in. But why look at, we're looking at others overseas, but we got to look at our own personal outcomes. So look globally, but act locally. Remember the Tokyo Olympics, Tokyo 2020, they're not requiring vaccines of everyone. They're not requiring vaccines, but they will have a strict testing regimen. So test before, return, during the season, and surveillance and protocol modification if necessary. There's a lot more that should be said, might be said, but I'll leave it here.